I think it's critical for us, to all of us, media, politicians, doctors, patients, stakeholders, to talk about this very important topic, because Nigeria has been deficient in the Abuja Declaration of 2001 about having 15% of the budget allocation to healthcare. We've been between 2% to about 6.7% in the last 34 years, and that's not been adequate for healthcare. You know that Nigerians' population is increasing every time. Already we're having population explosion. We are moving from 250 million to about 300 million. And the doctors in this country are really not sufficient enough, because a lot of people are leaving the country because of lack of proper remuneration, lack of proper welfare, lack of proper understanding, lack of love for them. You know, if you work for a long time in this country and you're not appreciated enough, you feel very, very, very bad. This topic is critical because we have seen Professor Temi talk about how we should improve budget allocation if we are sure about affecting and increasing the value of healthcare in this country. Government must be serious about the country.
The theme for today, you can see it's, of course, very relevant. Like you saw the guest speaker, drawing a lot of inference from what has happened all the while, particularly, emphasizing on the health budget, and the need to retain our own doctors and other health workers are trained, in Nigeria. Of course, you can see the emphasis on the budgetary allocation to health, and we cannot overemphasize that because it's very, very important for a nation to grow. The health, the head health of that nation must, of course, be top notch. That is one of the things we're trying to bring out, today.
We as doctors, particularly those of us who are older in the profession, we are all worried about the falling standard of the quality of life of doctors, the remuneration for hard work being done, the regular increase in burning out of the doctors on work, doctors even dying, collapsing from being overworked, and then grossly underpaid. It's worse than slave labor. And it takes a long time to train a medical doctor. Unfortunately, because we don't reckon with them in this country, other people abroad, they take them away from us, and they appreciate their worth, and they are properly remunerated. So without meeting here, all of us, we have to find a way to stop this unnecessary immigration of our doctors, and to find ways whereby we can actually improve the health care management in this country.
I think the organizers were looking at it. The theme they're looking at today has to do with the challenges that are affecting and the ramifications for budget allocations in the health sector. In other words, what is the financial outlay for health care in this country, and how much money is the government ready to commit to this process? And when you compare it to many parts of the world, starting from America, that allocates between 27% to 30% to the healthcare. In Nigeria, the highest we have ever allocated to healthcare was about 6%. Right now, it's like close to 2% of the budget being allocated to healthcare.